The shocking hidden costs of elderly healthcare in 25. Welcome to Smart Health Tips. In the year 2025, the landscape of elderly healthcare had shifted dramatically, revealing a complex tapestry woven with both advancements and hidden costs that many had not anticipated. The world had witnessed remarkable progress in medical technology, with telemedicine, artificial intelligence, and personalized treatments becoming commonplace. Yet, beneath this veneer of innovation, lay a series of shocking hidden costs that affected the elderly population and their families in profound ways. As the baby boomer generation continued to age, the demand for healthcare services surged. The healthcare system, already strained, struggled to keep pace with the needs of an increasingly older population. While many celebrated the breakthroughs in medical science, few understood the financial implications that accompanied these advancements. The promise of extended life and improved quality of care came with a hefty price tag, one that was not always transparent. One of the most significant hidden costs was the rise in out-of-pocket expenses. While insurance coverage had improved in some areas, many elderly patients found themselves facing high deductibles and co-payments that quickly added up. For those on fixed incomes, the burden of these costs was particularly daunting. Medications that once seemed affordable had skyrocketed in price, with pharmaceutical companies often prioritizing profit over accessibility. The elderly, who often required multiple prescriptions, found themselves caught in a web of financial strain, forced to choose between necessary medications and other essential needs like food and housing. Moreover, the proliferation of telehealth services, while convenient, came with its own set of challenges. Many elderly patients, particularly those living in rural areas, struggled with the technology required to access these services. The digital divide became increasingly pronounced, leaving some seniors isolated from the very care they needed. For those who could navigate the technology, the costs associated with virtual consultations often exceeded traditional in-person visits, particularly when specialists were involved. The illusion of accessibility masked a reality where many seniors felt more disconnected than ever. In addition to direct medical costs, the hidden expenses of caregiving loomed large. Many families found themselves stepping into caregiving roles as their loved ones required assistance with daily activities. While this was often born out of love and a desire to provide the best care possible, the financial implications were staggering. Families had to grapple with lost wages, the cost of home modifications, and the potential need for professional respite care. The emotional toll of caregiving was compounded by the financial strain, creating a perfect storm of stress and anxiety. Long-term care facilities, once considered a safe haven for the elderly, also revealed hidden costs that shocked many families. The average cost of nursing homes had soared, and while some facilities offered luxurious amenities, the quality of care often did not match the price. Families discovered that basic care services were frequently inadequately covered by insurance, leading to additional out-of-pocket expenses for necessities like personal hygiene, meals, and even social activities. The stark realization that a loved one's comfort could come at such a high cost left many feeling helpless and frustrated. As the healthcare system continued to evolve, the concept of preventive care gained traction. However, the implementation of these programs often came with hidden costs that were not immediately apparent. While preventive care aimed to reduce long-term healthcare expenses, the initial investment in screenings, vaccinations, and wellness programs could be substantial. Many seniors, already struggling with financial constraints, hesitated to engage in preventive measures, ultimately leading to more significant health issues down the line. The irony of preventive care, designed to save money in the long run, became another layer of complexity in the already tangled web of elderly healthcare costs. The rise of artificial intelligence in diagnostics and treatment also introduced unexpected financial challenges. While AI promised to streamline processes and improve outcomes, the integration of this technology into healthcare systems was not without its costs. Hospitals and clinics invested heavily in AI infrastructure, and these expenses were often passed down to patients. The result was a healthcare system where cutting-edge technology came at a premium. leaving many seniors unable to access the latest advancements in care due to financial constraints. Navigating the maze of healthcare plans and options became increasingly daunting for seniors and their families. The complexity of insurance policies, combined with the rapid pace of change in healthcare offerings, led to confusion and misinformation. Many elderly individuals found themselves enrolled in plans that did not adequately cover their needs, resulting in unexpected bills and a sense of betrayal by a system they had trusted. The hidden costs of navigating this labyrinthine system often outweighed the benefits of the coverage itself, leaving seniors feeling vulnerable and exposed. As the healthcare industry grappled with these challenges, the concept of holistic care emerged as a potential solution. Holistic care aimed to address not only the physical health of patients, but also their emotional and social well-being. However, the implementation of such comprehensive care models often encountered resistance due to funding constraints. Many healthcare providers struggled to balance the need for holistic approaches with the reality of limited resources, leading to a situation where the most vulnerable populations, including the elderly, were left without adequate support. Amidst these challenges, advocacy groups began to emerge, fighting for the rights of elderly patients and their families. These organizations sought to raise awareness about the hidden costs of elderly healthcare and push for policy changes that would alleviate financial burdens. They highlighted the stories of families who had faced insurmountable challenges, shining a light on the often overlooked struggles of the aging population. Their efforts brought some attention to the issue, but systemic change proved elusive, as the healthcare industry remained entrenched in its existing practices. The shocking hidden costs of elderly healthcare in 2025 were not merely financial. They also had profound emotional and psychological effects on seniors and their families. The stress of navigating a complex system, coupled with the fear of financial ruin, created a pervasive sense of anxiety. Many elderly individuals reported feelings of isolation and despair, exacerbated by the challenges of accessing care. The emotional toll of these hidden costs was often overlooked, yet it played a critical role in shaping the overall experience of aging in the modern world. In this landscape of uncertainty, the need for community support became increasingly evident. Local organizations stepped in to fill the gaps left by the healthcare system, providing resources, education, and assistance to families navigating the complexities of elderly care. These grassroots efforts aim to empower seniors and their families, offering a sense of connection and solidarity in the face of overwhelming challenges. While these community initiatives could not solve the systemic issues at play, they provided a lifeline for many, reminding them that they were not alone in their struggles. As 2025 unfolded, the conversation around elderly healthcare began to shift. More individuals and families started to advocate for transparency in healthcare pricing, demanding clearer communication about costs and coverage. The push for policy reform gained momentum, as the public became increasingly aware of the hidden costs that had long been swept under the rug. Advocacy efforts emphasized the importance of prioritizing the needs of the elderly population, urging lawmakers to consider the long-term implications of their decisions on this vulnerable demographic. In the face of these challenges, there was also a growing recognition of the importance of planning for the future. Financial literacy programs aimed at educating seniors and their families about healthcare costs became more prevalent. These initiatives sought to equip individuals with the knowledge and tools necessary to navigate the complexities of elderly healthcare, empowering them to make informed decisions about their care. The realization that proactive planning could mitigate some of the hidden costs of healthcare began to take root, fostering a sense of agency among seniors. As the healthcare landscape continued to evolve, the need for a more compassionate and equitable system became increasingly apparent. The hidden costs of elderly healthcare in 2025 served as a wake-up call, prompting a collective reckoning about the value we place on the lives of our aging population. It became clear that addressing these hidden costs required a multifaceted approach, one that encompassed not only policy reform, but also a cultural shift in how we perceive and care for our elderly citizens. In the end, the shocking hidden cost of elderly healthcare in 2025 were a reflection of broader societal values and priorities. As families grappled with the realities of caring for their aging loved ones, they were reminded of the importance of compassion, connection, and advocacy. The journey toward a more just and equitable healthcare system for the elderly was just beginning, but the seeds of change had been planted. With continued awareness and action, there was hope for a future where the hidden costs of elderly healthcare would no longer overshadow the dignity and quality of life that every individual deserves in their golden years. If you found this information helpful, don't forget to like, share with your friends and family, and subscribe to Smart Health Tips for more valuable health insights. Have any questions or experiences to share? Drop a comment below. We'd love to hear from you. Let's build a healthier future together. See you in the next video.